Good morning friends. Today we'll discuss about the previous year question of INI-CET, Neet and the FMGE. Okay. So the first question here is, it is a lengthy question. A 50 year, always remember if it is lengthy there will be clues will be there. Okay. So a 50-year-old chronic alcohol. First point, male agricultural worker presented with high grade fever because of 1 week duration which is in rigor. So respiratory system shows a crepitation and bronchi. Okay. So subcutaneous nodules were present on the left forearm and the left leg. So the important is the direct microscopy shows a gram-negative bacilli with the bipolar staining, and it also shows a rough corrugated grey-white colonies. And the organism seems to be motile and oxidase positive. So here the clues are, the options given they are plague, melioidosis, Bartonella and actinomycosis. So first how you can remember this? So plague, it is a gram-negative bacilli with bipolar staining, but it does not produce any skin lesions. Whereas Bartonella also, it does not produce any skin lesions. Actinomycosis, it is a gram-positive bacilli. So here the option will be in melioidosis. So it always presents with the pulmonary infections ranging from abscess, pneumonia to the tuberculosis. Lymphadenopathy will be the skin ulceration, and it has it also calls in Vietnam time bomb disease. Okay, because they will be having a long latent period, and it is an agent of bioterrorism. So here the selective medium will be ash tone medium, and treatment consists of two. One is ceftazidime and another it is in carbapenem. Okay. So here the clue you want to pick up here is, one, it is a gram-negative bacilli with bipolar staining. The main, it is in corrugated grey-white colonies. It is usually present only in the Burgholderia species. So coming for second question, treatment of choice for Stenotrophomonas maltophilia. Azithromycin, aminoglycosid, cephalosporin, levofloxacin. So always remember it is in levofloxacin, because these are mostly resistant to the antibiotics. So we will be using some of the combination like cotrimoxazole, ticarcillin, clavulanate and levofloxacin. So coming for third question, centripetal rash is seen all of the following except. Yeah, it is in secondary syphilis. Okay. As you know, measles will be presenting with the centripetal rash, typhoid, yeah, it is an, and then epidemic typhus specifically it will be having a centripetal rash. So the exclusion will be in secondary syphilis. Okay. So next question, it is in bacterial vaginosis is identified by. So options given here are pH is less than 4.5, green colored vaginal discharge will be there. And second point is pH is more than 4.5 and clue cells and fishy odor with KOH. Here also pH is more than 4.5 and white creamy discharge will be there. And here the option 4.5 and okay. So always remember the pH will be more than 4.5. So you want to rule out only these three options. So here white creamy discharge is mainly for Candida. And here the foul smelling discharge will be there, but it get accentuated by KOH. Okay, so that seems to be within two options, that seems to be a better option. So go for that. So that is an Amsel criteria. It produces thin, low viscous, white, homogeneous white discharge, and pH will be more than 4.5, and the fishy odor will be aggravated by adding 10% of the KOH, that is a whiff test, and clue cells will be there, that is called as in vaginal cells coated with an cocobacilli. So coming for fifth question, a patient presents with rashes all over the body except palms and the soles, and he does not have any history of any animal exposure. The condition may be associated with which of the following conditions? Epidemic typhus, Q fever, Rocky Mountain spotted fever, and rickettsial pox. So here sparing palms and soles. So it is an epidemic typhus. Okay. So whereas endemic typhus, it will be first produced by tongue and followed by all the extremities. And what is about Rocky Mountain spotted and Indian tick typhus? It presents in both the palms and the soles. And vesicular and varicilliform rash will be presenting in rickettsial pox and African tick bite fever. In Q fever, there will be no rash. So with this point, you can easily exclude that. So in our question, they have given like sparing palms and soles. So you can go for what is it? Epidemic typhus. Because Q fever fever, it doesn't produce any rash, whereas Rocky Mountain spotted fever, it will be having present in the palms and the soles. So whereas rickettsial pox, it will be presenting within some of the what is the vesicular rash. So here the answer will be epidemic typhus. Thank you, friends.